Here is the review session for Unit 7, Celebration 7 for AP Psychology for Turner, the Illness and Therapy Review. Keep in mind there will be 46 questions on this test along with 2 FRQs. Make sure you go way back to the beginning and get the 3 Ds for abnormal behavior: deviant, distressful, and dysfunctional, and you can apply them to the symptoms or the diagnostic criteria of any of the disorders. We talked about research methods. I definitely would brush up on my twin and adoption studies for the nature-nurture / biological idea. Case studies are definitely going to be used, even though generalizability is low. In order to deal with each patient and get a diagnosis, we need to do a case study. Surveys are going to help us with interviews, determining what's normal, and that sort of thing. And then blind studies are going to be used with the biomedical approach. So review those a little bit. Looking at disorders themselves, make sure you understand what the Diagnostic and Statistical Manual includes and that it does not include treatment. Going back again to the beginning with the issues of getting a label, in particular think of the on being sane and insane places that we read about, where once somebody got a label, that everything they did, seemed to match the label, and how that's not appropriate. And then certainly the biopsychosocial connections, both in the origins, but also in the treatment. And you've got not only a graphic organizer for that, but that should also be in your notes. And then finally, the peanut butter and jelly diathesis stress model. If we come in with a genetic predisposition, it's made that much worse by stress. You need to know the details, which neurotransmitters and which agonist and antagonist help with the disorders of depression, for instance. There are a couple, more than one neurotransmitter related to that. SSRIs would be good to know. Schizophrenia, I have too much of what? Parkinson's, I have too little of what? And what the heck's happening with acetylcholine with Alzheimer's? Insanity, we spent a little time on that. Make sure you know how that is a legal term and how that differs from an actual psychological disorder. Within the disorders, we've got the groupings, the categories, but also the subtypes. Use your mnemonics. Make sure you know what's in the subtype and how they differ from one another. So for instance, in anxiety disorders, we have specific phobias, we have social anxiety disorder, panic disorder, agoraphobia, that is a specific element all in its own, it's not a specific phobia, and generalized anxiety disorder. How can you tell the difference among all of those? We have post-traumatic stress disorder, which now is under the stressor and trauma category. So how is that? Yes, there's going to be some anxiety there, but yet how is that different? And then obsessive compulsive disorder, make sure you know the difference between obsessions and compulsions. I can have an obsession about wanting to, lick my shoe, I suppose. My compulsion would actually be doing it then. That's a strange one. Body dysmorphic disorder is also under OCD now, and as long as you got the muscular dysphoria was another kind of subtype. And then the idea of hoarding is its own little category within OCD. Continuing with this, mood disorders. Remember, we've got bipolar is all on its own, and there are different types of bipolar. We are most concerned with the differences between bipolar 1 and bipolar 2. Depressive disorders, make sure you know the difference between major depression and persistent depressive disorder. And also the suicide facts as far as prevention, and all those things that were related to that. And then the dissociative disorders, okay, that idea that when we dissociate, we zone out. DID, I've got more than one identity, and I'm still functioning in life, but I have different names and different voices and all that good stuff. We have amnesia with and without fugue. Make sure you can distinguish the difference. And then we have the depersonalization or derealization, and we saw a clip about that in class. So I'd go back, and that's one you don't see very often, but be aware of that one. Psychotic disorders. Psychotic disorders are the most severe. They start with that break from reality. The only disorders that we're going to look at are the schizophrenia and schizoaffective disorders. Keep in mind, though, that other disorders may not start out as psychotic, but may become psychotic if they go on long enough, i.e. bipolar. So within the spectrum of schizophrenia, the more you have, the further you are on the spectrum. So we have all the 2 different types, actually 4 different types of delusions, disorganized thought. With perception, we have hallucinations, auditory, visual, really all of the senses. And with emotions, we have the flat affect. We also have ideas like catatonia, echolalia, echopraxia. If those aren't sounding familiar to you, you better go back and review. And then schizoaffective is a psychotic plus the mood disorder. Again, you probably won't see any examples on that, just know that that is one. Make sure you can distinguish among all the personality disorders. We have the 3 clusters of personality disorders, and remember, they can be pretty similar, so go back, look at your mnemonics, see what you have for those, especially those that are very similar, like, as I have here, borderline versus dependent. They're both about, trying to get people to stay with you, but in borderline, you're much more domineering in how you relate to people. With dependent, you're submissive to get them to stay. And usually with dependent, it's more than one person. We also have the difference between paranoid, schizoid, and schizotypal that are very similar, so make sure you can distinguish among those. Histrionic versus narcissistic versus antisocial. There's just a lot there. With any personality disorder, remember those are hard to treat, they often go undiagnosed, and there is no biomedical option for personality disorders. Somatic symptoms disorders, they're anxiety related to the body. Make sure you know the new names: illness anxiety, functional neurological disorder, somatic symptom disorder, factitious disorder, factitious on another, and know the differences among all of those. And then for our neurocognitive disorders, we did these in class. They were not in your reading, but they all have some sort of significant cognitive reduction. We have our dementia cases with Parkinson's, and some of people in Parkinson's, Alzheimer's, and Lewy bodies. And then we also have traumatic brain injuries, where we've got retrograde and anterograde amnesia. We also talked a little bit about concussions in that area. For therapies, we did the history assignment, so make sure you can trace the progression of treatment through history. Know key people: Pinel, Dix, Rush. Remember, some of them are actually psychologists, some of them were physicians, some of them were nurses, so make sure you know who did what. And the idea that we went from demonic possession to being weak-willed to unconscious aspects in the medical model back to our biopsychosocial aspect. You read a little bit more about careers that help with mental illness. Not a bad idea to go back and just see the difference. There's not too many, but just kind of look those over again. We talked about the opposite of the DSM, which is called the VIA, the Values and Actions. And that's deals with positive psychology, with Martin Seligman, the whole idea of resistance. How can we mentally kind of build ourselves up or exercise before trauma hits? With therapies themselves, we have key people in each perspective. There is a wonderful review page in your binder that has these, so make sure you go back and look. What did Carl Rogers do? Aaron Beck and Albert Ellis are both in the cognitive, so how do I tell the difference between them? What did Freud do? So almost everyone except for group therapy has somebody specific with that. Pros and cons. When are we going to use the therapies? Not only do you have the Ellen practice example in your binder, but you also have your own case study that you wrote and had to come up with some different therapies for that. So I would make sure you could do that. And then finally, some of them have subtypes. So like humanist has the subtype of Gestalt therapy. Gestalt is not it's a form of group therapy that is humanistic in nature. I will not let Gestalt and group therapy be used interchangeably, so make sure you know the difference. We've got psychodynamic, we've got interpersonal, RET, so I'd go back and look at those. How the perspectives view the causes for disorders. Again, you've got a wonderful graphic organizer in your binder where we talked about this. Psychoanalytic, for instance, talks about repressed traumatic memories. For instance, there might be another one that talks about, I don't know, chemical imbalance in the brain. Another one that talks about lack of self-fulfillment. So make sure you know those specifics. And then within those, know the specific treatments. This part of the FRQ, and this is where people can be hurt greatly. So you better know what free association is and that it's under the psychoanalytic area. You better know what active listening is and which area that goes with. The ABCs of RET, that goes with cognitive. Token economy is with behavioral. Transference, again, is with psychoanalytic. Systematic desensitization is with behavioral. And aversive is with behavioral. And those are some, but not all. So make sure you know what goes with what. You must know those specifics for the FRQ. All right, then if you look at the different disorders, some disorders benefit from particular types of treatment. For instance, dissociative disorders go best with psychoanalytic because of that unconscious mind. Okay, and remember, I won't actually say unconscious on the test, so you gotta, somehow figure that out. All talk therapy is psychotherapy. Psychoanalytic is a form of psychotherapy. And watch out for incorrect matches. Thorazine, for instance, is as an antipsychotic drug, not used for depression. ECT is used for depression, it's not used for anxiety. There's no biomedical aspects for personality disorders, at least that we know of yet. And notice this is the second time I've told you about that. And finally, FRQ, the hints, the details are the key here. So make sure whatever disorder it is that you can match it to the 3Ds. You got to know what the 3Ds are, and that's how we started this PowerPoint. For each disorder, when I say diagnostic criteria, I'm talking about the symptoms. Make sure you can tie those into biopsychosocial aspects like twin studies. Adoption studies are always obviously going to be on the biological side. The diathesis stress model, peanut butter and jelly, this is the second time I've brought that up, don't forget that. And then finally, make sure you can give a differential diagnosis. Can you tell me how two disorders are similar, but yet how they're distinct from each other? So if I label someone as bipolar, what's similar to bipolar, but yet how do I make the distinction? And then lastly, treatment options, as I mentioned in the previous slide, have to be specific. If you're using biological/biomedical, what specific drug would you prescribe? Use that organizer in your binder. Use that organizer in your binder. Use that organizer in your binder. If you know that, you will not be disappointed. So other than that, there really shouldn't be any surprises. There's just a lot of detail. So use your learning strategies, chunk things so that you understand them, and I know that you will do very well on this.